Hello, I'm James Mallory. I'm Chairman of the Iredell County Board of Commissioners. And once again, on behalf of the entire Board of Commissioners, I'd like to share with you a COVID-19 update for Iredell County. It's May the 21st, 2020, and we do have some good news. We have, as a state, qualified to transition from Phase 1 to Phase 2, moving from a technical stay-at-home order to now a safer at-home order pursuant to the Governor's Executive Order number 141, which was issued yesterday at 5 o'clock and is now being poured over to parse through the details of how we are to re-engage our economy across the board. First, I would like to start off, though, recognizing our emergency service workers. It's Emergency Services Week, and that covers a wide range of individuals who are on the front lines every day, from emergency communicators to emergency medical service to fire, rescue, law enforcement, our emergency room physicians and nurses and staff. All of these are on the front lines helping people every day, and during this COVID-19 emergency, they have been putting their shoulder to the wheel 24 hours a day at the citizens' beck and call. So we want to give them a salute for the great job that they do and the sacrifices that they make on a daily basis. I'd also like to remind you that if you've lost track of what a weekend is, we're coming up on the Memorial Day weekend. Memorial Day on Monday is the national holiday that is focused on remembering those who have died in the service of their country. You know, all service members, whether male or female, give some, but some have given all. And it bears remembering how many have given their all. You know, the oldest veterans that we have today are in their mid-90s, veterans from World War II, that greatest generation. And that greatest generation suffered battle losses as well as associated losses in theaters of about 405,000 men and women. From 1946 to the present, and this includes the Korean War, the Berlin Airlift, the Vietnam War, the Gulf War, Iraq, Afghanistan, and every other conflict from 1946 to the present. We have had 102,435 deaths. And it's those servicemen and women that we remember on this very solemn Memorial Day. It's a solemn day of remembrance, but it's a wonderful weekend. And it's a particularly poignant weekend this year because we were able to transition from Phase 1 of our lockdown sort of to a Phase 2 as we gradually reopen our economy. The current situation with the United States is we've had about 1.5 million positive confirmed COVID tests. Of that 1.5 million, we are closing in on 94,000 deaths, and it's projected that we will go over 100,000 by the end of the month. When you think about it again, we had about 102,000 killed in action or in theater from 1946 to the present in our armed services. And we have almost lost that same number of people in the United States in the last 3 months. So COVID-19 is a very serious matter. And as we open up our economy, we cannot lose sight of the fact that we need to remain vigilant, that we cannot become overconfident, we cannot become complacent, we cannot become careless with our own actions because those actions have an impact on other people. So Today, in North Carolina, we have over 20,000 confirmed cases. Over 700 have unfortunately passed. And in Iredell County, we have 203 cases, and we have 6 fatalities. And of those 203, 72 are currently recovering at home, and 4 are in the hospital. That is down from 6, and 121 have recovered. So what does this mean going to phase 2, a safer at home order? Well, when originally conceived, the process was a little more expansive because of concerns over some trends that are just marginally acceptable based on the metrics, and seeing the possibility of some hotspots and some outbreaks that are occurring throughout the state. The governor has decided to continue to manage this at the statewide level. He has mentioned that there might be a possibility of moving to a regional or a county-based process at some point, but he is not yet persuaded by the metrics that we are in a position to be able to do that, because obviously this virus does not respect county lines or state lines for that matter. So in the transition to phase 2, the following businesses are going to be impacted. It's a little more modest than we had anticipated, but 50% restaurants will be able to reopen with indoor dining, which will be limited to basically 50% of capacity. Personal care services, your barbers, your beauticians, your manicurists, tattooists, masseuses, all of those will be able to re-engage and open with a 50% capacity and appropriate social distancing. Swimming pools will be opening, so just in time for Memorial Day. It's a little bit cool this last week. Hopefully it'll warm up. But once again, a 50% capacity. Child care facilities will reopen for all, not just essential business personnel or essential business employees, but for everyone. And the businesses that unfortunately will not be able to resume completely are our bars and nightclubs and gyms and indoor entertainment centers. All will remain closed. Mass gatherings are remaining to be defined as limited to 10 indoors and 25 outdoors if it's in some kind of a confined area. Of particular note, worship services are not restricted by the mass gathering criteria. Of course, there is a federal injunction right now that was effective until the 22nd, or 14 days, that basically found that that was not a constitutional restriction, at least on a temporary basis, until final arguments were heard. Now, the governor's order can be, or stricter guidance can be enacted by local jurisdictions. So that federal court case may still have some relevance relative to what other jurisdictions may or may not do to have stricter restrictions on worship services. I will say that Iredell County nor any of the towns, municipalities in Iredell County, we do not have a pre-existing stay-at-home order that other counties such as Mecklenburg had a pre-existing order, and so to the extent that that is stricter and not amended, then the Mecklenburg County order will apply in that jurisdiction. But we do not have any, so The only restrictions are what the governor has placed in his executive order. And we have that executive order on our website, and I would encourage you to read it. It is very detailed. If you are in business, you will want to understand very completely what the ins and outs and requirements are so that you can be in compliance. Your business plan needs to be devised and implemented as soon as you can in a safe fashion. And our restaurants, if they need assistance, we had a presentation by our Public Health Department information officer who gave some information about the ability to request our restaurant inspectors to be able to come out and assist restaurants in determining how they can meet the social distancing criteria and the capacity requirements and all of the different sanitation requirements in order to be in compliance with the governor's directive. We have moved from this phase 1 to phase 2 based on an analysis of a number of different criteria. I think it's helpful to understand what those criteria are. The first is COVID-like symptoms that have been observed at our emergency departments. That could be COVID, or it could have been the flu, or it could have been pneumonia, anything that had the hallmarks that potentially could have been COVID-19. And the state was looking at a stable or declining rate in those numbers to be able to move through this second gate. And the state meets those criteria. They were also looking that confirmed by test COVID-19 cases would be stable or declining. The state has not met that requirement, nor has Iredell County. We continue to increase in terms of numbers to 203 today. But the reason for that increase is primarily driven by the increase in the number of tests that are being administered. So that's solving a problem that we had, which was a lack of testing capacity. And that testing capacity is now coming online, and you should be able to get a test, call your physician, and ask for instructions on where to go, and you can get tested. If you have any symptoms, which would, clearly be the fever, unexplained fever, and cough, or even the loss of your sense of smell or taste. Some people have other symptoms, COVID toes, they call them. They have this odd sort of a collection of discoloration on their toes. I mean, if you have any concern, you need to contact your physician and get tested, because those tests are available. But because more people are getting tested, more people are being determined to be positive. So you're going to have this inverse relationship between these two metrics. You want both of them to be stable or declining, but when you have a smaller number of positive tests, which is another criteria, a smaller percentage of tests, which we do have, that's stable or declining, the fact that you're giving more tests means you're going to have a greater number of actual cases. So those two criteria are somewhat contraindicated, and that has been taken into consideration in the determination to move to phase 2. The final criteria is hospitalization rate. We are low. We only have 4 folks hospitalized and 3 hospitals. So we're nowhere near our capacity, and the state of North Carolina, in fact, is nowhere near its capacity, even though more than 500 people are hospitalized. So that's the good news. We bent the curve. We did not overwhelm our healthcare providers. And as a result, anyone who needed treatment, even ventilators, have been able to obtain that. So moving forward, we've got to be able to walk and chew gum at the same time. It is not an either or of being safe and healthy and having an economy that is functioning. We can achieve protecting lives and livelihoods at the same time. In fact, it's an imperative. We have to. So as we look to opening our businesses, I would encourage people to do a couple things. Number one, get out and support those businesses, particularly our local Iredell County businesses. Because people haven't been going to restaurants, they haven't been purchasing as many items, the sales taxes are down because sales are down. That impacts the county's budget. It impacts our ability to provide you services. So if you're going to be out spending dollars, I'd encourage you to spend them locally because that's going to be turning around and supporting you with the services that you need. Safety for businesses is good for business. As we move into this more free opportunities to be able to get out and about, it's important to realize that you need to balance your personal choice and your freedoms with your personal responsibility to yourself and, more importantly, to others. You know, our businesses are going to be required to take certain steps, whether some of them may be required to wear masks. In some instances, that may be optional. It depends on what's in the governor's orders. But those businesses are trying to comply and to make it feasible for anyone to be able to come in and safely patronize their business. They aren't making rules just to make rules. There are a lot of vulnerable people out there, elderly people, people who have compromised immune systems, who still need to get out and about and to patronize those businesses, want to feel assured that they are protected. And our businesses want to make sure that their employees are protected from folks who come in. So understand that while you have a choice, and you know, when you're outside and you're maintaining social distancing, there's no reason to be wearing a mask, quite frankly. But when you go inside, or when you are in a situation where even outside you are within 6 feet or closer than 6 feet from people for any extended period of time, then wearing a mask is not just a protective thing that you can do for yourself, but more importantly, it protects others. And that's what we've got to be looking at. We got to look at looking out for our fellow man. And we need to understand that everyone is trying to navigate this whole situation as best they can and do so with an element of charity and grace to your fellow man. As I said before, we need to guard against complacency. You know, back in the first week of this COVID lockdown, I mentioned that we are like Patton's army going across France after having had a breakout and gotten our hands around the problem. In World War II, they were racing towards Germany, and very little was standing in their way. There was a lot of talk in the fall of 1944 about being home at Christmas. Well, what happened was a Christmas surprise. It wasn't the Christmas present that people had been hoping for, because the Germans counterattacked in the Battle of the Bulge, and we were caught by surprise. And we lost more casualties in that battle than virtually any other battle in the continent of Europe. We expect, you know, this virus is not gone. It has been beaten down. It will have localized outbreaks and spikes that we will need to respond to and contain so that they don't spread beyond the small area that they are confined to. And we're going to have the tools with which to do that. We're working to make sure that we have enough PPE, that we've got the testing capability, that we've got the contact tracing capability for our health department. But we have to be able to respond, and the best way to keep a counterattack from happening is to be constantly on the offensive. You don't let the enemy attack you if they're more focused on defending themselves. And that's what this virus is. It's not going to be some big second wave, in my view. It's just not going to hit the whole United States again, sort of like we got hit to begin with. But it is going to be hit with a series of mini waves in different locations and localities. And we need to make sure that we are vigilant and that we don't allow that within our power to happen in Iredell County. I am very proud of the effort that people have made that have kept our testing and COVID rate down at 203 compared to several counties surrounding us. It's a much lower per capita rate. And I will say this concerning our own county. You know, we have divided it into 3 different geographic areas: northern area, which is everything north of Interstate 40, central area, and then the southern area, which is really the southernmost 4 zip codes. And in those numbers, the way they break out today, we have 38 cases confirmed in the north, 71 in the central area, and 94 in the southern area. Now, when you look at where we started, the majority of the cases, 62%, were in the southern area of the county. Over time, the entire county has got about the same per capita rate as our population. Those numbers that I gave you reflect about the same infection rate per capita no matter where you are in Iredell County. And the numbers in the south have gone from 62% to about 46%. So it is a county-wide issue, and we need to remember that. There's no one that is exempt just by virtue of their geographic location. What matters is our personal choices and whether we're thinking through our personal responsibility to others and to our family members. So, with that admonition, once again, I want to congratulate everyone on the job that they've done, the sacrifice that everyone has made. And we now need to be putting our shoulder to the wheel in terms of getting our economy back on its feet so that we can indeed, when we find a vaccine that is safe and effective, and we will, and there's some very positive news on that front, but it takes a significant period of time to be able to go through these trials and then go through a production process for over 300 million vaccines. So we hope we'll have that, late this year, if it's early, or it could be, sometime in the winter or even the spring of 2021. We just don't know. But until that happens, that's sort of the Manhattan Project of World War II. The Manhattan Project was the development of the atomic bomb, and it was a secret, kept even from the Vice President, Harry Truman, who, when he ascended to the presidency upon Franklin Roosevelt's death, found out that, they'd been working on this Manhattan Project for a top secret atomic weapon, which they then used 2 of in Nagasaki and Hiroshima, which effectively ended the war in the Pacific. That act is projected saved 1 million lives, 1 million casualties on the beaches of Japan. If you look at the casualty rate on Okinawa, and that's what they were basing our casualties on the islands of Japan. So our Manhattan Project is that vaccine development, because that will stop this assault on our society. But until it's there, it's all about our individual actions. And that boils down to the 3 W's. That's wait. So when you're in line, wait 6 feet apart from folks, maintain that social distance. Wear a mask when it's appropriate, and wear it for other people. It's not a statement as to whether you're concerned about your own safety. It's a statement that you're concerned about other people's safety, because you can be symptomatic with COVID and not know it. And it's not just an elderly disease. North Carolina now has its first confirmed case of a inflammatory condition for adolescents and children. And now it's a very rare condition compared to the numbers, but it is nonetheless a demonstration that we don't know everything about this virus. We don't know how it impacts all age groups, and we certainly don't even know what kind of long-term effects it may have to people who had relatively minor symptoms. So it's a thing to be taken seriously. And finally, besides waiting and wearing, washing. Wash your hands. Use your sanitizer. Get a small sanitizer bottle and carry it with you. That is probably the most common form of transmission, just people touching doorknobs and commonly used objects. And this virus will remain on those objects for a number of hours. So with that, I want to wish you a meaningful Memorial Day holiday and a blessed week.